medication label. First thing I want to cover is the brand name. Here the brand name of this medication is Pretend Med, and the brand name is the registered name given by the drug company who owns rights to it. And you may notice next to this brand name a registered trademark symbol, which is an R with a circle around it, and that means it's registered. Now there are patent protection rights that are given to the company who will solely market this medication under its brand name. So there won't necessarily be a generic form of the drug available yet until this patent protection runs out. Now, once the patent runs out, other companies can market the drug and may create different brand names for a medication, but you should always be able to see the generic name as well. And the brand name is usually a lot easier to pronounce and spell than the generic name. And the first letter is capitalized, and it's usually the largest and boldest. Now, typically found very close by that brand name, usually under it, is the generic name. And here in this example, our generic name is Fo-Pharmamide. And the generic name represents the active ingredient in the drug, which is why many times the generic name is a lot longer and it's harder to pronounce and spell because these names are chemicals. Now, there is only one generic name for a drug. There can be multiple brand names, but only one generic name, and it will always be included on a medication label. Now, sometimes you may be looking at a label and you will just see a generic name, and this will be used for medications that have been on the scene for decades and they're very well known by this name. These names will typically have the parentheses around them and will all be in lowercase letters. Now, one thing that is helpful for us nurses is that the ending of most of the generic names tend to be similar for certain groups of medication, which makes it easier to identify what medication we're giving to the patient. For example, the generic names for ACE inhibitors typically end in pril, like lisinopril, or beta blockers. They tend to end in LOL, like labetalol. Now, as a nurse, it's very important to be aware of both the brand name and the generic name because the doctor or whoever is writing medications for this patient may write you an order for the brand name, but pharmacy supplies you with the generic name. For instance, the physician orders Lasix, but you're supplied with furosemide. You would know that this is the same medication. And the reason for this is because the generic form of the drug, whenever it is available, tends to be a lot cheaper than that brand name. So it's saving your patient hundreds to even thousands of dollars. And these medications work the same. It's just cheaper for the patient. So one thing you want to keep in mind, if your patient, let's say, is taking the brand name at home, whenever you go to administer that drug and it's the generic form, they may look at the pill and say, hey, this doesn't look like my pill I take at home. Are you sure that this is the medication? Well, after confirming it is, you want to educate the patient generic and brand names. Those pills, capsules, tablets, whatever, they tend to look different. Now, sometimes next to the generic name, you may see the letters USP. What does that mean? What does it stand for? That stands for United States Pharmacopoeia. And this means that that medication has passed specific quality standards and has a seal of approval on it. It doesn't represent a certain measurement of the drug or how the medication is released in the body, which leads me to my next point. If a medication is designed to be released in the body in a certain way, this type of release will be listed to the drug's name and it will be specified on the label. For example, here with this medication label, it says Pretend Med XR. XR is not its brand name. It is telling you that this is a different release of the medication. So XR stands for extended release, and that's even further specified a little bit lower on the label below the generic name. It tells you that these are extended release capsules. Now, there's different types of releases. Some examples would be like CR, that stands for controlled release, IR, immediate release, EC, enteric coated, CD, controlled delivery. And the reason I point this out is because it's very important the nurse looks at this part of the medication label to verify what type of release this medication has. Because depending on the form, the medication may not be able to be crushed or chewed, because if it was crushed or chewed and it was one of these special releases, it could alter the rate at which the medication works in the body and could be not very good for the patient. Another thing you want to be familiar with on the medication is the supplied form of the medication. This tells the nurse how the medication is supplied. For example, here our label tells us that our medication is in capsules, but you can also have medications in tablets or even solutions and suspensions. And here you can see that this medication tells us that it is an oral solution, but this label tells us that it is actually going to be an injection solution because we're dealing with something that's going to go intravenous or intramuscular. You can also have topical, suppositories, etc. Next is dosage strength. This is the amount of drug that is in the specific dosage form supplied, and you will see a number with the measurement unit beside it. So let's look at this medication label of Pretend Med. Our dosage strength is 250 milligrams. So what does that mean? Well, a lot of times you can go and look at the medication instructions and it will give you further details about this. But what this means is that each capsule of this Pretend Med or Fopharmoide contains 250 milligrams. So let me test you here for a second. Let's say the doctor orders Pretend Med and they order 500 milligrams PO daily. How many capsules are you going to give this patient with each dose? Well, we know by looking at this label, each capsule contains 250 milligrams. The ordered dose is 500 milligrams. So we are going to give 2 capsules to equal that dose. But now let's look at this medication label. We have the brand name medication, Imagimed, has a generic name of Fictitious-Omad. It's an injection, so we're dealing with a solution. And it tells us that it has a dosage strength of 5 milligrams per 5 mLs, or also equivalent 1 milligram per 1 ml. So what that is saying is that for every milliliter you draw up in that syringe of that medication out of this vial, you are giving 1 milligram. So it's the equivalent of drawing up 5 mLs to give 5 milligrams. So let me test you again here. Let's say the doctor has ordered the patient to have a one-time dose of 2.5 milligrams of this medication. How much are you going to draw up? Well, we know that 1 milliliter equals 1 milligram. So we are going to draw up 2.5 milliliters, which will equal 2.5 milligrams. And then just to give you another example of looking at that dosage strength, let's look at this medication label. We have the brand name Faclixer with the generic name of Mixtrazole Difecate, and we know that it's an oral solution. So it tells us that it has a dosage strength of 350 milligrams per 5 mLs. So what that means is that for every 5 mLs that you're measuring out, you're pouring out, you're giving the patient 350 milligrams of Faclixer. So let's say the doctor ordered the patient to have 700 milligrams once a day of this medication. How much would you pour out to give to the patient to equal that dose? Well, we know for every 5 milliliters you're pouring in there, there's 350 milligrams. So we need to give 700, 350 plus 350 is 700. So we would give 10 milliliters. Next is the route. On the medication label, you want to look to see if it specifies what route this medication should be given. Here we have a medication in the form of capsules. And generally speaking, capsules and tablets are understood to be given orally unless it's specified directly, because some medications may be supplied in a tablet form, but they need to be taken sublingual or the buccal route. For instance, like nitroglycerin, it's like these little tabs. We give them to patients who are having chest pain. That goes underneath the tongue. And on a bottle of nitroglycerin, it will actually say sublingual tablets. So always look at that information. Now there's other routes that medications can be given. For instance, here our label tells us it's via injection, and it says below that, it says for intravenous or intramuscular use. You could also, with some labels, it will tell you can maybe give it sub-Q, so you can give it subcutaneous. In addition, other medications can be given via the eyes, the ears, rectally, vaginally. They can be given via inhalation, nasally, transdermal. So always double check that. Next is total amount or volume. And this is the total amount or volume of that medication in that container, bottle, or vial, whatever you have on hand. And here it tells us that there are a total of 50 capsules in this bottle. Now with solutions, the total amount will be written like with a volume. volume. For instance, this vial of Imagimed, it tells us that it has a total of 5 milliliters in it. And over here with our fake elixir, it tells us that this bottle has a total of 100 milliliters in it after reconstitution. So once we have prepared it the way that the manufacturer wants us to prepare it, it should have a total of 100 milliliters in it. Next is the lot number and expiration date. So these two numbers are typically located together. So the lot number is helpful in identifying a recalled medication and to help the manufacturer track the medication. The expiration date tells you when the medication is expired. So as a nurse, you always want to check this, especially the expiration date, and you don't want to administer an expired medication to a patient, but discard it according to your facility's protocols. Next is the medication instructions. This is a section found on most labels that's going to give you some detailed instructions on the medication, such as dosages, how to prepare the medication, reconstitute it, storage details, etc. So let's look at this medication label of fake elixir. So over here, it tells us that this bottle contains a total of 7 grams of mixtrazole difecate. And that's just telling us that in this whole bottle of this medication, there's 7 grams of it. And it's telling us that in each 5 mLs, there's 350 milligrams of this medication. So that further gives you information. If you're a little unsure by looking at that front part of the label, that confirms how much is in each little dosage that you measure out. Then it says the dosage. See pamphlet included with the medication package. A lot of times manufacturers will include this little fold out piece of paper that will tell you detailed information about the drug if you need to know that. And then here, this is one of those ones that need to be reconstituted. So we have to prepare it in a specific way before we administer it. Right now, as it is, it's not ready to go. So it's telling us to add 80 mLs of water to the bottle to shake thoroughly, and this is going to prepare our 100 ml oral solution. So we want to do that before we give that to the patient. Now, it's telling us that once we prepare this medication, it's going to expire in 14 days. So you definitely want to label this, let other people know when this was made and when it expires. Then it goes into detail about storage. It tells us that we need to keep it refrigerated between 35 to 46 degrees Fahrenheit and to keep it away from light. Next, you may see the manufacturer and the distributor's name and address, who made this medication and who is distributing it. It can be the same name or 2 different names. And then you will find a barcode on it, and this is used many times in the hospital setting to help identify the medication in the medication system and during administration. And lastly, we have the NDC number, the National Drug Code number. And this is the number the FDA uses to identify drugs. It has